Are you an international medical graduate who is dreaming to start your career in Australia but is still confused about how to enter Australia? Then this video is for you. Please keep watching. Hi, my name is Dr. Saida and welcome to IMG Career Support. So this is a platform where I teach all of you how to land your first job in Australia. In this video, we will be talking about what are the possible pathways that an international medical graduate can come to Australia and start working as a medical practitioner. But we will be more focused on the standard pathway, and the reason is that 80 to 90% of international graduates come to Australia via this pathway. There are four major pathways to enter Australia as an international graduate. The first one is the standard pathway, then we have competent authority pathway, then we have the specialist pathway, and then we have a short-term training pathway. So standard pathway is for those doctors who have not graduated or are currently practicing in competent authority countries. This means that if you are a doctor who has graduated or is currently practicing in Pakistan, India, Bangladesh, Sri Lanka, or countries like these, then you will enter Australia via this pathway. The very first step will be creating an account on the Australian Medical Council's website. The website that you will go to is www.account.amc.org.au. This is where you will create an AMC portal, and they will give you a candidate number, which will be your AMC candidate number, and this will then link to your EPIC verification account. Once you received your AMC candidate number, you will then start verifying your credentials on the EPIC verification portal. You will then upload your credentials and get them verified. You need to get your MBBS degree verified from the EPIC, and once you send it for verification, they will then send, your college will then send it to the AMC Council. While you're in this process, try to stay in contact with the HR department or the department in your university that handles this process, so that you can stay updated on whether they have sent the verification yet or not. The standard time for this verification process is usually around 2 to 10 weeks, but that depends on how fast your university has worked on this project. Once you're done with making the EPIC account, you will then be eligible to apply for the AMC CAT MCQ exam. This is also known as AMC Part 1. So AMC exam is a very structured exam, and they will test your knowledge based on recent Australian guidelines, and they would ask questions which are clinical scenarios rather than asking basic questions of anatomy, physiology, pathology, etc. This exam comprises of 150 MCQs to be answered in a time span of 3.5 hours. The main hack to the exam is knowing whether you're actually prepared for it or not. So once you start preparing for this exam and once you're halfway through it, try to assess yourself by doing recalls or by doing maybe AMC handbook, whether you are able to answer these questions, and this will then tell you whether you are ready to book the exam or not. Once you feel that you're halfway there, then you must book the exam, because why do it late? Just do it early and secure your spot in Australia. Okay, so the most commonly used resources for this AMC CAT MCQ exam is John Murtagh, which I think the latest edition is 8th edition. So this book actually has a lot of topics, and it is divided based on the clinical scenarios rather than systems which we usually see in textbooks like Davidson, etc. So this book is kind of tricky, but once you give it a really good read, you will feel the difference that a lot of these questions and a lot of clinical scenarios are asked completely based on this book. Then your second resource is the AMC handbook. This book is a little bit outdated, but it will give you a generic idea about how questions are usually asked in the AMC exam. You might not want to follow the explanations and the answers of it, because since this book is a little bit outdated and a new edition has not come as of yet, you need to find out your answers from the recent Australian guidelines. Apart from this, one thing that really helped me with my preparation was Master the Boards by Conrad Fisher, which is like a very common book used for the USMLE prep. And then Medscape. So Medscape does have recent guidelines, and you will find a lot of dosages and proper tips and tricks written over there. So it is much more easier to follow than a lot of Australian guidelines. But your answers have to be really based upon the Australian guidelines, which have to be recent. So you will be following all the general practice questions, and you will be doing these from RACGP website, which is actually a website for Royal Australian College of General Practitioners. But they do have a lot of research papers, and there are a few questions that have come from the case scenarios that are present on the AGPT and RCGP website. Moreover, for the pediatrics guidelines, you will be following RCH, which is the Royal Children's Hospital guidelines. And so when you go to this RCH website, you will find out that like all the protocols are written very clearly in a proper step-by-step approach, and they will completely tell you how to deal with a pediatric patient in Australia. Then for the gynecological questions, we have guidelines called RANSCOG. So it is the Royal Australian and New Zealand College of Obstetricians and Gynecologists. So once you go to these three websites, which are the RCGP, RCH and RANSCOG, you will find out a lot of Australian guidelines, and you have to read this topic by topic. So this might be sounding very overwhelming, but the truth is that when you do your theory once, you will have a really good grasp on what the Australian guidelines are all about, and the next time you will be only revising everything. So the trick to this exam is, once you're done with like the first very good read of your theory, make proper notes like really good students. So make proper notes, and then try to solve recall questions or the questions that are given in the AMC handbook. Because once you're through this, then you will realize what your theoretical notes are lacking and how will you do the second read of the complete guideline. To get the recall questions, there are a lot of Telegram groups where you can find the past papers, but the major issue is that a lot of these recall papers do not have the correct answers, because they are usually faint recalls, or maybe a lot of doctors have sat down together and have solved these recalls based on half of knowledge, like whatever they've studied so far. So please do not fall for this. What you will be doing instead is, you will read the recall questions, and then with the question even, you will get the idea about what topic is coming in the exam. And once you know the topic, please go to the guidelines again and read the topic completely. You will have all the answers over there, and you do not need to fall into this recall trap. So now this is the hack time. I will tell you one really important hack that will help you clear your AMC exam and secure a better result. The hack is that AMC actually schedules the exam for a few days every month. The exam is not conducted in the months of December and January, but it is conducted from February to November. So what you will do is, when you go to the AMC scheduling account, you will see that every month they have like a few days that they will be doing the exam. For instance, you are scheduling for the month of March, and the dates available are maybe from 7 to 14th. So from 7 to 14th, the exam will be held. What you will do is skip the first 3 to 4 days at least, and you will be booking your exam after 11th or maybe 10th. So like you can book your exam on 10th, 11th, 12th, 13th, 14th, pick one date and book your exam. So the reason I'm telling you this hack is that exam questions are repeated every month, and the repeating rate is almost 60 to 70%. So anybody who is scheduling on day 1, day 2, day 3, they might not get the similar questions, but anybody is scheduling on day 4 and afterwards might get a lot of questions that are already being asked on day 1, day 2, day 3. So if you are in these Telegram groups, and if you know people who are like doing exam on day 1, day 2, day 3, then you can get the recall questions, and then you can easily revise these questions 1 to 2 days before your exam from the Australian guidelines, and you will easily crack your exam. So now we're done with the AMC exam, and good news, you passed it. What's the next step? The next step is to quickly get done with your English language exam. And the reason is that even though you can apply to the to hospital jobs without the English language exam, but it is mandatory for you to have your language, like a valid language exam, while you apply for the registration to AHPRA. So obviously, if a hospital is reviewing your application and they see your clinical experience and everything, but you do not have a valid language exam, then they would definitely consider a candidate who has a valid language exam, because that candidate would be ready to get his registration via AHPRA. And now that I have started working with a lot of doctors, and I have been tutoring them throughout this job hunting process in Australia, I have realized that there are still a lot of doctors who are not taking this seriously, and they're not getting done with their language exam, maybe because they're not attaining their desired score, or maybe they're started applying for jobs without even thinking of the language exam. So this is where the barrier comes. Even if you secure a job, the hospital would ask you to get your registration done ASAP, and these days AHPRA is usually taking only 2 to 3 weeks for registration as compared to the whole year. So the hospitals would definitely prefer a candidate who is completely ready to apply for registration and who will get his registration done within no time. So let's talk about the English language criteria that you need to attain for AHPRA registration. You can apply for IELTS, PTE or OET, and all of these are accepted, but there is a fixed criteria to the score system. If you are doing IELTS, you need an overall score of 7.0 with a divided score of at least 6.5 in writing and at least 7.0 in listening, reading, and speaking. For PTE, you need to have an overall score of 66, out of which you can have a score of 56 in the writing part, and then you need to have at least 66 in listening, reading, and speaking each. If you're going for OET, you need to have a minimum of C+ in writing and a minimum of B in listening, speaking, and reading. Also, the validity of these language exams is 2 years. So if you have done your language exam maybe 1.5 or 2 years back and it's near to expiry, please redo it so that you're ready for the AHPRA registration if you are in the job hunting process. Good news, you have already done your AMC 1 exam, and now you have also done your English language exam, and you're completely ready to get registered with Australia. But there's a catch. You need to find a job first. So in Australia, what happens is once you're done with your AMC 1 and your language exam and you're ready to get registered with AHPRA, the first step is to find a job. And once you have a job with you, then you can get registered with AHPRA. A very important point to note here is that even though you require AMC 1 plus AMC 2 to get your general registration or provisional registration, but you can still apply for jobs and still start working in Australia with AMC Part 1 on limited registration. So now we will be talking about the 3 types of registrations that a standard pathway candidate usually has. The first one is the limited registration. So anybody who has done AMC 1 and has a language exam, has secured a job, he will be granted a limited registration, and that is valid to be renewed for 3 times only. So this means that on limited registration, you can work for only 4 years and not more than that. Then comes the provisional registration. So provisional registration is for candidates who have AMC 1 and AMC 2, which is the AMC clinical. They have a valid exam and they have secured a job in Australia, and now they're applying for a registration with AHPRA. So they are granted provisional registration. And general registration is for those candidates who have AMC 1, AMC 2, and 12 months of supervised training in Australia. So if you are someone who has done AMC 1 and have a valid language exam, and now you're looking for jobs and you secure one, then you will be granted limited registration with AHPRA, which can be renewed up to 3 times. But if you have cleared AMC 1 and AMC 2 and now you're looking for jobs, then you will be granted provisional registration with AHPRA. So now that you will be applying for jobs, and once you go through the whole interview process and you secure a job, then you will be eligible to apply to AHPRA for a proper registration, and that usually takes up to 2 to 3 weeks now. So my registration took 3 weeks. But in last months, we have seen that AHPRA registration took 5 to 6 months at least, or maybe at least 4 months. But that was only because they were renewing their system. But now that the system is fully renewed, they are granting registrations within 3 to 4 weeks. Okay, doctors, now you know about the standard pathway, you know about AMC 1, you know about the criteria for the language exam in Australia, and you will be fully ready to secure a job in Australia. What's next? The actual job hunting process. It's draining. It's gonna physically, emotionally, mentally drain you, but that is what I'm here for. And there are specific tips and tricks, and if you do not follow these tips and tricks, you might as well waste over a year finding a job in Australia. But if you follow these tips and tricks, you might secure a position within the next 2 to 3 months of applying. So the next step for you guys is to like this video and subscribe to the channel and wait for the next video where I will be telling you all about what is the actual job hunting process and what are the tips and tricks to land a job in Australia and how easy it gets when you use these specific tips. So thank you everybody for watching till now. Please like this video and subscribe to the channel. Comment below if you have any question about the standard pathway or any other pathway about how to find jobs in Australia, or if you have any other question in your mind, and I will be answering your questions in the comment section below. Please make sure that you subscribe to the channel as well, and the reason is that this channel will be pure gold for you. I will be telling you all tips and tricks over here and how to apply for jobs, how to perfect your CV, how to make a strong cover letters, and how to address the selection criteria. So thank you so much for watching and stay tuned for the upcoming video. Bye bye.